Welcome everyone to today's webinar, Not Just Operations, How Your Supply Chain Can Be a Strategic Asset That Supports Elevated Clinical Performance. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We will have a series of poll questions during today's webinar. You can submit the answer that best applies to you directly on your screen in the slides box. Thank you in advance for your participation. Third, today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. And lastly, if at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. With that, I'm pleased to welcome today's speakers. First, we have Christina Tosto, the Vice President of Operations of WaveMark Supply Management and Workflow Solutions at Cardinal Health. Next is Matt Brugman, the Director of Distribution Services at Cardinal Health. And third is our featured speaker on today's webinar, Dr. Ann Snowden. Dr. Snowden is the Chief Scientific Research Officer at HIMSS Analytics and developer of the Clinically Integrated Supply Outcomes Model. She also holds academic positions at several universities, has published more than 140 research articles, papers, and cases, and received over $22 million in research funding. She holds a PhD in nursing from the University of Michigan, a Master of Science from McGill University, and Bachelor in Science in Nursing from Western University. Christina, Matt, and Dr. Snowden, thank you for being here today. Dr. Snowden, and I'll turn the floor over to you.
Thank you ever so much. I am absolutely delighted to share the work we've been doing at HIMSS on advancing the clinically integrated supply chain maturity. If you'd like to go to our first slide, we'll get right underway. If ever there was a time that supply chain has become front and center in global health systems, you have to admit with the global pandemic, this is the time. We have seen really tremendous fragility, if you will, in our health supply chain, and that is really consistent no matter what country we are looking at. We've had incredible disruptions in critical supplies, no surge capacity, very limited preparedness for pandemic stockpiles that were maintained. A very interesting and worrisome at time dynamic called Me First, I think first coined by our colleagues in European Union, where countries who produce critical supplies, whether it's PPE or vaccines or particular drugs, have adopted a strategy where they keep those products in-house within their global borders to make sure their populations are cared for, while other countries scramble to try and offset those shortages by finding other alternative products with varying degrees, of course, of success. We also see, depending on the different jurisdictions you look at, a very limited data infrastructure that's able to identify and link product supplies, locations where they're needed, where cases now are surging, and those supplies are going to be needed in much higher levels of utilization and demand, linking things like product needs with testing, COVID testing, et cetera. So really lacking data infrastructure between public health, hospitals, community systems, and even government agencies to know who is at greatest risk, where are those hotspots, and how best do systems shift and pivot quickly and with high degree of agility, which in many jurisdictions just didn't happen. I would also suggest that really supply chain has become a moral imperative. There is evidence and data emerging very quickly that supply chain capacity directly links to whether patients are able to receive care and may survive or not survive transmission of this particular virus, and whether our workforce is healthy and safe, and we have the workforce capacity to surge to meet the demands we are seeing in many populations. If you go to the next slide, workforce, I would suggest, is a particularly important link to supply chain capacity. We saw tremendous levels of fear and uncertainty in many jurisdictions that led to not coming to work because they're afraid of A, getting sick, or B, bringing it home to their families. Depending on what surveys, what data you're looking at, there's anywhere from a 20 to 40% rate of clinicians at various levels deciding whether they will not just leave their jobs, but leave their disciplines, and a great deal of challenges with confidence in the safety of their work environments directly attributed to the level of transparency of supply chain products. In other words, as a nurse, physician, social worker, whatever discipline you happen to be, if I don't have the confidence of being safe in my workplace, and that confidence is driven by transparency and what supplies do we have? Do I have N95s or other protective equipment I'm going to need to deliver care as safely as it needs to be delivered to protect that patient, but also myself. If you go to the next slide, really these are a quick snapshot, an overview of what a supply chain is today, and really the road forward. And many organizations, many jurisdictions are looking to achieve a much greater resilient supply chain. And one of the pathways and strategic roadmaps available is the clinically integrated supply chain, which at HIMSS we are defining as the ability to track and trace every product, every care process delivered to every patient, identifying every provider team delivering that care, where that data flows automatically right at the point of care in every clinical setting, and that data uploads to every individual patient care record. It's only when you can link your products, the care processes where those products are used, the provider teams delivering that care, link it to a patient outcome, that's when we'll have actual real-world evidence of outcomes, impact, and value. And that's really the hallmark of a clinically integrated supply chain. Next slide. So what does that really look like on the ground? What it really means is we are integrating very deeply the ERP data, where most supply chain data is held, what products, what manufacturer, what barcode standardized identification of those products, integrating that with the patient EMR so that you get now an integrated data set. Once you apply an analytics engine, now you have an ability to identify what products and care delivery processes are working best and for which segment of patients. Every patient, or generally every patient in most hospitals, are placed on clinical pathways. Those pathways predict or at least guide care delivery. But we've all come to the realization, and that's another thing COVID has shined a very nice bright light on, it doesn't work the same way for absolutely every patient. We've seen huge differences in the African American community, African Canadian community in terms of their outcomes on COVID, which look vastly different from their Caucasian counterparts. So being able to analyze and identify what's working best for whom, and under what conditions are you achieving best outcomes, that's where your predictive analytics strategy can now come into a very, very important role, but only when it has all of the data flowing automatically and linking to every individual patient. And that's what clinically integrated supply chain actually achieves. If you go to the next slide, there are really 4 key dimensions. This maturity tool was actually developed on the basis of evidence-based in the literature of what is a supply chain, what does it look like in healthcare, and what are the key dimensions in a supply chain, a clinically integrated supply chain that drive high-performing organizations. First and foremost, automation of work environments. I'll share a bit of data about with you in just a moment. But the more we automate our work environment, the more we are able to optimize workflows for our clinician teams. And if this ever, where there was a time, this is one to be paying attention to that, to retain our clinicians, make sure they feel confident in their work environments, and they have the data right at the patient point of care for every individual patient. Clinical integration is all about the degree to which supply chain teams or supply chain expertise is embedded in our clinical program teams. Because how else are we going to know and make decisions on which of the various products, supplies, equipment, drugs, whatever the case may be, has the best quality and value for patients? Clinicians are best suited to identify quality outcomes, whereas supply chain teams are best suited to make sure they're ensuring they've got the best possible products available that achieve those best quality outcomes for patients. Predictive analytics, you can flow all your supply chain ERP data and connect it to your EMR data very nicely. But if you're not analyzing that data and transforming data into knowledge and insights, then you're not actually delivering at the point of care to those clinician teams which patients are at greatest risk, which products may be expired or have recently been recalled, and helping those clinicians proactively prevent or mitigate risk, again, right at the point of care. All of that, of course, is supported by very strong leadership and governance strategy that absolutely recognizes supply chain as a strategic asset. Now, I used to have to spend a lot of time talking about that pre-pandemic. Those days are gone. Most everyone in the world, even our various country leaders, prime ministers, presidents, and premiers I happen to be in Canada, all use the term supply chain, whereas just 18 months ago, that just never happened. So I think there's a strong realization of the critical importance of supply chain in enabling health systems to deliver care that there wasn't even just 14, 15 months ago. One supply chain leader explained it to me this way. He said, Anne, for decades, we've been at the bottom of the birdcage, and now suddenly everyone realizes how important supply chain really is. If you go to the next slide, let me touch on very briefly what each of the four dimensions really focus on. Automation of clinical workflows is all about point of care capture of data, capturing product data, procedure data, specific patient data, all using preferably GS1 or global standards to identify them. One of the things we saw in this pandemic is when you ran into critical shortages, many teams could not identify easily alternatives to those N95 masks or those gowns or the other products that were in such short supply, because we've not adopted a global language to make sure when we look for an alternative product, it's got a standardized label that we can be absolutely confident that product is what it says it is. There's only one global standard, hence the maturity model requires a GS1 standards adoption at level 1, because if we're not all using that same global language to identify products, you'll never actually achieve the automation otherwise that might be possible. Online adverse event reporting and at the point of care alerts to our clinicians on a product that's potentially placing that patient at risk, for example, a drug that may have an adverse event for that particular patient's clinical scenario. Go to the next slide. Automation certainly supports and enables clinicians, but integration of supply chain teams in clinical teams takes it to a whole new level to really understand quality and safety of care, linking product data, of course, the various patient care needs and programs and models of care being delivered, where clinicians are best able to identify that particular joint implant has the best outcomes for this segment of patients based on this particular data. And that's where supply chain teams work hand in glove with their clinician leaders to understand the real world evidence that's emerging around outcomes being achieved and the value for those particular patients, the levels of risk, opportunities to mitigate risk, reduce errors, reduce and even eradicate what we refer to as never events, and inform procurement decisions. That it isn't always, and what we've been through so many years gone by, cheapest, lowest cost to achieve best value. It's no longer about lowest cost. It's the stability of the sourcing, the differentiation, and having sources that are domestic as well as global that really have a much more balanced supply chain infrastructure and supply chain sourcing of products that are critical for patient care delivery. Next slide. And then there's, of course, analytics. Analytics is probably one of the least well-developed dimensions of this maturity model, and we're seeing that in some of our other maturity models, and we do have a long way to go. But analytics in this model is all about transitioning from where we are today, which is very much react and respond. What we saw in this pandemic was we run into critical shortages, and then the whole world scrambled to try to overcome those shortages. This is all about predicting. Where are we at risk for those shortages? How do we overcome those risks? How do we mobilize alternative sources of products or perhaps alternative care delivery possibilities to predict and act to make sure those risks of supply shortages or critical shortages never actually materialize and never get as far as compromising our clinicians' confidence in their work environment or compromising patient safety. Next slide. Governance and leadership. That data flow, that automated flow right from the point of care up into that EMR, those analytics that now allow us to track which patients are doing exceptionally well, having best outcomes. How do we look at the other patient cohorts that aren't achieving those outcomes and get everyone to that point where they're achieving best possible outcomes? That's all about transparency, flowing data and outcomes to our senior team, to our clinician teams, program teams to understand where in fact are we achieving best outcomes and what do we need to do to shift our care delivery to each of the respective patient groups we're caring for to ensure everyone has the best possible outcomes. It's also about tracking and understanding workforce and making sure our clinician teams not only have all of the products available to them when and where it's needed, but they feel confident that those products and those tools and PPE, especially now, are available when and wherever they may be needed. If you go to the next slide, supply chain now has taken on a whole new value proposition. For patients, it's transparency. It means that as a patient, if I happen to be that patient going in for that knee replacement or new hip or the cardiac catheterization, I have access to all of that data. I know what implant was used. I know what that stent is. And if there's, in the event of a recall or a problem or an adverse event, I'm able to report it. And I'm able to engage my clinician teams on how to solve that or prevent any risk that may come with it. It's also about safety. Patients having the confidence in their clinical environments that they know and are confident that errors will be at an absolute minimum because of that access to data right at the point of care. Next slide. For clinicians, provider teams, absolutely critical importance, that automated work environment that's data-driven. So we have access to that data is transformed into knowledge, insights, potential ways forward in terms of care delivery strategies, and now I have confidence that I've got everything I've needed, but I also have access to all of the data about every individual patient I'm caring for, and that drives safety and quality and confidence in the work environment. A few comments on outcomes. If you go to the next slide, a consortium, this is just a summary of data of outcomes we're seeing in a group of 10 North American hospitals shared with one of our partners. Huge improvements in terms of clinical engagement and decisions, replenishment, stock taking, stock outs, drastically improved when you automate and you improve your supply chain maturity in a health system. If you go to the next slide, we've conducted 3 country-level case studies, and these are 3 health systems, one in Canada, one in UK, and the other in the US. That just gives you a sense of the level of outcomes, both in cost savings, but to some degree in labor saving costs and safety events. In Alberta, they implemented a fully integrated, digitally enabled supply chain across the entire province. That's a western province serving about 4.5 million people over a landmass slightly larger than the state of Texas. They have after 7 years of rolling this out province-wide, over $300 million in savings just attached to inventory savings. Because as soon as you optimize inventory, you're no longer throwing out all the products you didn't use and expired too quickly because you ordered too many or you didn't order products mapping to utilization rates. Similarly, in the NHS, in a 2-year project, it was actually 4-to-1 return on investment just from inventory savings, 30 million pounds sterling savings in month, just again, supplies cost saving if scaled to all of NHS 142 trusts, And they actually reported a 70% reduction in never events. Those are the never operate on the wrong body part, never deliver care to the wrong patient. There's about 10 or 12 of them, and a very impressive, almost overnight reduction in never events, again, because of data flowing right to the point of care, able to alert and flag clinicians to risk of error so that clinicians can actually prevent those errors from ever happening. In the US, one large health system posted $1 billion in savings, again, just on supply savings, 30%, nearly 30% decline in labor costs per case because of the automation in those clinical environments, and a 33% decline in their supplies costs per case. That data is all pre-pandemic. We are actually looking to consider whether we'll do the same case study approach post-pandemic, but that's very much underway now. If you go to my next slide, all to wrap up, clinically integrated supply chain is not just about saving money and automating work environments and patient safety. It really maps directly onto the quadruple aim. It improves provider experience, again, the automation of workflows and the capture of data right at the point of care with the accompanying supports to identify risk. It's absolutely focused on clinician experience, quality of work life. Cost of care very clearly reduces labor costs per case because of automation, but also substantive impact on supply costs. Transparency in data about what care is provided, what products were used, all linked to outcomes, which now can flow right directly to patients and patient experience. And the last one, clear evidence and real world evidence of outcomes. What are we achieving for who? How are we achieving best outcomes? And how do we scale so that every patient in an organization, health system, country, jurisdiction has access to those very best outcomes and the conditions under which best outcomes are achieved. So with that very quick overview of what a clinically integrated supply chain is, I'm going to hand over to Matt, who can share some more insights into how this works from WaveMark's perspective.
Thanks, Dr. Snowden, for sharing some great information about how to think about a clinically integrated supply chain. So I think now that we understand the importance of the clinical integration, I think it'd be good to take a step back and think about how a product moves through the supply chain. So before we jump in, I wanted to take a quick poll to get a sense for how everyone feels about their own state of visibility within your supply chain. So as we pull the poll up here, how would you respond to the following statement? I have visibility I need in my supply chain to advise my organization. Strongly agree, agree, neutral, disagree, or strongly disagree. And we'll give it just a few seconds for answers to populate here. Okay. We'll go ahead and take a look at the results and see how the group self-assessed. It's a fairly evenly spread, a bit of a grouping here around agree. So really interesting, I think some outliers on both the strongly agree and strongly disagree front. But this is great, and hopefully we can provide some more insight here as we go. So, as you can see, there's a lot of room for visibility within your supply chain. To start, we'll talk about exactly where you should look for increased visibility at different touch points along the different areas of your supply chain. So as we move to the next slide, we'll follow a product as it moves through the supply chain, kind of differentiating between what happens before a product reaches your facility, seen here in steps 1 through 4, and what happens after a product reaches your facility at step 5. I'd say visibility is a crucial component as a product goes through every step of the value chain, really from the manufacturer all the way to the receiving dock. and from your receiving dock into a clinician's hands. From the perspective of a distributor and manufacturer, we know it's critical to share as much real-time line-of-sight information as possible as a product moves through the value chain. So, I'll say the pandemic's accentuated some areas of opportunity for us, in particular as a distributor. And over the last 12 months, we spent a lot of time listening to our customers, and as a result, we're deploying resources more strategically, especially when it comes to providing greater visibility and transparency within the supply chain. So, starting with this roadmap, we'll follow a product through each step of the progression and highlight key areas that can benefit from increased visibility, starting with data to inform your demand plans. Next slide, please. So first, we'll talk about what you buy and specifically what your demand needs are. Now, this might seem intuitive, but health systems first need visibility into what they're purchasing. Make sure you have the ability to access your entire product assortment and choose the optimal products and solutions for your needs. It's important to take a proactive approach to demand planning while making purchasing decisions. So for example, if a certain product has a history of supply disruption, as Dr. Snow had kind of alluded to earlier, a facility should include this upfront in their considerations when defining their product assortment. As you determine your assortment, it's extremely valuable to integrate feedback from your clinical teams. As Dr. Snow mentioned in her presentation, in an optimized supply chain, clinicians will work with supply chain teams to ensure the best quality and value for patients, which really requires a clear understanding of your facility's demand needs and therefore your product assortment. Distributors should provide their customers with visibility into recent shipments based on current and predicted future demand patterns. And really, since the pandemic, we've worked to build 3 complementary dashboards to equip our customers with the information needed for effective demand planning and purchasing decisions. Really quickly, the first is a retroactive view of supply flow, which is intentionally designed to dissect the variance in between supply and demand from a product level all the way up to major clinical categories. The second is a tactical report of what products are currently available in relation to historic utilization needs, as well as potential substitutes. And third is a dashboard that details short and long-term views of predictive supply health. So these insights tools for demand planning have played a critical role in helping our partners gather more information and take the most control of their supply chain while equipping us to help work together on issue resolution if challenges arise. Next slide, please. So moving on to the next 2 stops on the roadmap we saw, let's talk about probably the 2 biggest areas where you'll benefit from increased visibility: your relationships with your manufacturer and your distributor partners. So health systems are facing increasing opportunities to leverage the data provided by these partnerships. This data can help inform future purchasing decisions that might be better aligned to a facility's operational, financial, and clinical goals. Many manufacturers are able to provide insights into predicted utilization of a particular product. And at your facility, compare these numbers to your actual utilization rates to identify any gaps or trends. This can really help improve the accuracy of purchasing decisions and automate purchases where possible. I'd say next, focus on where you can optimize your distributors' capabilities. Many distributors will have predictive data and insights to share, especially if they also manufacture many of the products that they distribute. Look into how products are being received at your facility to further inform your demand patterns. So as an example here, a point of care delivery model can provide even better insights into product usage within specific departments within a facility. So, point being, health systems should work in tandem with their manufacturer and distributor partners to create dashboards and utilization models that can better predict supply flow and help build targeted demand plans. Work with your distributor specifically and see how you can develop tools that will not only give you increased visibility over your supply chain, but also increase control over your purchasing processes. Next slide, please. So moving on to the next area, visibility during product transit is another space where we've seen a lot of development and innovation. One way to gain more control over your entire supply chain is by looking for advanced technology capabilities that can provide detail on your shipments in transit. Tracking devices can provide real-time logistics insights, such as mapping exactly where a product is within the transit process. And I'd say also distributors and manufacturers have increasingly incorporated machine learning to capture past tracking information from their customers to better predict ETAs for future shipments. Next slide, please. So really, this leads us to the final stage of our roadmap, which addresses optimizing your supply chain once the product's received within your facility. As Ann mentioned, governance and leadership are pivotal elements of a clinical integrated supply chain, and this is where your supply chain really becomes a strategic asset. To help with this, Cardinal Health offers insights and optimization solutions that generate recommendations to help optimize your supply chain using data and industry benchmarks. As an example, we have tools that can assist with par level and supply mode optimization to help you understand and improve the overall health of your facility's inventory strategy. Another example is our Spend Essentials program, which offers product standardization insights based on your facility's utilization within a specific product category. Once a product's received within the four walls of a hospital or health system, there's still further opportunity for increased visibility into the remaining product life cycle, as we said, from receiving dock into the clinician's hands. At this point, I'll pass it over to my colleague, Christina, who will speak to another opportunity where your health system can integrate broad capabilities to achieve a fully integrated supply chain.
Thanks, Matt, for the introduction to Cardinal Health and how our offerings can help elevate supply chain teams and support clinical performance. Your discussion is a great segue to talk about best practices, processes, and technology solutions that can help you manage the product within the four walls of your health system, as Matt mentioned, once you've received product from manufacturers and distributors like Cardinal Health. But before we jump into it, we want to hear from you guys again and ask about the state of your supply management. So based on the statement, my organization has the supply management insights we need to optimize our supply and clinical workflows, allowing us to better care for our patients. Please select strongly agree, agree, neutral, disagree, and strongly disagree. And we'll give it another few seconds, as we did before, to watch the results come in. Okay. Let's see how the responses look. I think it's pretty similar to what we saw in the previous question. Many of you feel like you're in the neutral to agree, but by virtue of what we see here, it looks like many of you feel that your health system would benefit from improved insights to optimize supply chain and clinical workflows. So with that in mind, we're now going to focus on how automated technologies can really support your need to access and utilize more rich data sets. As Ann mentioned earlier, automation is a huge step on your journey to a clinically integrated supply chain. So implementing supply automation technologies is one strategy that can help support collaboration between clinical and supply chain teams so they are better aligned in their processes to enable patient care. In order to have visibility to the products on your shelves, you need to have a solution that's going to help you capture and analyze your product usage data. This will help you tie it back to the patient and then allow you to have the insights you need to make optimal care decisions based on that specific patient population. Health systems need a technology that enables a consistent workflow throughout each facility and department. That's from receipt of the product to usage and reorder, and capturing and aggregating the necessary data to give your teams invaluable insights for improving potential impact to patient care. So next, what I want to outline is a few key things that we believe an ideal automation solution should support. First, number one, capture of global standard product data. That includes lot, serial, expiration, manufacturer, etc. Upon registration of product in your health system, the automation technology should proactively track product details to alert supply chain staff and clinicians to at-risk products. This includes proactively tracking product expiration to remove that from the shelves and notifying staff of any kind of recall that could impact your product so they can be removed before they're potentially selected for patient care. But even further than that, the solution should provide clinical alerts at the point of care with the patient as a last line of defense to make sure impacted products are not used on a patient during a case. Two, Connecting product usage to the patient record. Product usage details should be tied back to the patient record using clinical systems and EHR interfaces. This allows your teams to access to valuable usage data among patient populations and can help your health system to analyze what types of products were used on different population segments. 3, efficient product data capture for clinicians to help maintain product availability. A supply chain automation solution should enable clinicians to get back to their patients and not feel that they have to worry about supply chain management activities, and it should support seamless and efficient product documentation at the point of care. From that documentation, the solution should be able to support and maintain product availability to ensure continuity of care and limit the risk of case cancellations due to product stockouts. Because items are tracked as they are used, the demand signals can be sent to your ordering system to ensure product is available when needed. And furthermore, the system helps analyze usage data to recommend department par levels and ensure your system is maintaining an appropriate inventory level. And then 4, it's the insights from advanced analytics. There are tons of benefits to having visibility to the rich data that supply automation processes can provide. So one unique use case is to use that data to help support standardization of care efforts. As Dr. Snowden mentioned, having data isn't everything. You have to be able to use it. So when products are tracked at the point of use and tied back to clinicians and individual cases, you can analyze the data to identify opportunities, for example, to standardize product usage across doctors and case types. So for instance, if Dr. X and Dr. Y are using 2 different products for the same procedure, and we're ultimately seeing the same outcomes, there's an opportunity to standardize the product and process of care based on data aggregated from the automation system. When you do that, you streamline workflows, it helps maintain product availability, and helps support optimized care, ultimately supporting patient outcomes. As a certified organization for the HIMSS CISA model, Cardinal Health Wavemark, we're aligned to these industry best practices that we've just outlined. Our solution portfolio combines managed services with advanced supply chain automation technologies that helps hospitals like yours adopt some of the foundational elements of a clinically integrated supply chain and supports them on their journey as they continue to progress against the model. So to wrap it up, I'm going to pass it back to Dr. Snowden and ask that she close out the presentation and suggest some practical next steps for a health system as they take and consider their path to clinical integration.
Thank you so much. And we've had a few questions in the chat box, which I'm very grateful to receive on. Tell me a little more about clinical integration that is a distinction from supply chain excellence. So let me walk you through a typical example of what I'm seeing in global health systems. I talked briefly about that NHS example of integrating a clinical integrated supply chain. They started with their perioperative program and their procedural areas like interventional radiology, primarily from the perspective that that's where their highest supply cost is. As soon as they achieved this clinical integration and this automation, where they were flowing product data right to the individual surgeon and patient EMR, what they started to generate then, of course, is think of a surgical report card. Every surgeon, as they walked out of their operating room, had a complete inventory listing of every product they use. And yes, they do capture every product, even a Band-Aid and a mask, what cost those products achieved, and then they compare that data to that surgeon's and that particular patient's particular outcomes. So the chief of surgery happened to be an ear, nose, and throat surgeon. He decided with that objective level data on every surgeon, he created that benchmarking so that every departmental meeting every month, every surgeon got their ranking in terms of what best clinical outcomes they were achieving, like infection rates, readmission rates, lengths of stay, all of the usuals, mapped to the products they were using, the type of implant, was it a cement implant versus a non-cement, or on and on. And very quickly, the surgeons in every department, which they scaled it to, knew exactly what the ranking was to their counterparts. They looked at what their colleagues in first and second place were doing in terms of what products, what practices, And they almost immediately or overnight reduced clinical variation so that all surgeons were using approximately the same products, techniques, processes that got them to that tied for first place or second place. What happened overnight was the reduction in clinical variation informed by this objective data. In a US system, again, same system we did the case study on, they did exactly the same thing. Every surgeon walks out of the operating room, they get a list of their quality indicators for individual patients, their average quality indicators across all of their patients, the exact cost they spent on every individual case. They look at that data across each of the specialty groups of surgeons, identify what are the minimally acceptable levels of quality outcomes, time in the OR, use of their OR blocks, all of those other operational kinds of indicators, and immediately, given the nature of surgeons and cardiologists and many of these specialists, their very competitive nature, their clinical variation almost just completely disappeared, so that virtually every patient and every clinician was operating with the best possible products and processes and care procedure practices to achieve the best possible outcomes for the majority of their patients. So it was almost this natural phenomenon. The supply chain team didn't have to fight with the clinician teams on what was the best product or the cheapest product or the best quality product. The data emerging from the supply chain, the clinically integrated supply chain, flows right to clinicians, and clinicians make the decisions on what are the best products and care practices achieving the best outcomes for patients. So hopefully I've answered some of those questions that came out, and I'm happy to discuss that offline if it's helpful. If you go to the next slide, where do you start? The first thing you do is you measure what have you achieved so far. And that was really the design of the Seesaw maturity model. It gives you a very detailed analysis of where your strengths are, where the areas for development are, and some possible suggestions or recommendations as to where you might start to get from where you are today to where you might want to get to tomorrow. Next slide. The process is simply an online tool. You complete that survey, you get a baseline score. We give you a very detailed assessment with recommendations on where you may wish to consider advancing, and then you actually essentially, that informs your strategic roadmap forward. Go to the next slide just to summarize what in fact this clinically integrated supply chain is. It's very much a roadmap, a strategic roadmap to start from wherever you happen to be. If you're starting from level 0-1, adopting global standards, optimizing and automating your inventory management, that allows you the infrastructure to track and trace every product, every patient to that patient outcome. That now in data all starts to inform quality and safety outcomes. For sure, what we've seen so far is very significant reduction in medical error. Clinicians are able to prevent those errors before they ever happen. You've also got real-world evidence of transparent patient outcomes across their entire hospital stay. That now allows you, although we haven't seen it yet, this is very aspirational, level 6 and 7 of the model, to use predictive analytics tools to identify if this particular patient is coming in for this particular procedure compared to all other like patients in your particular hospital, what are the best products that are going to achieve the best outcomes for this particular person's case scenario. And that is just barely starting to unfold at level 6 maturity. Level 7, of course, is personalizing it right to that individual patient's goals, whether it's mobility for a joint implant patient or it's quality of life for a patient with heart failure. It really is a roadmap to a personalized and much more precise healthcare delivery system. So with that, let me go to my last slide and just come back to where we are today, heading into this, hopefully sooner than later, this post-pandemic system. We've absolutely figured out we can learn and we can implement faster. We have overnight implemented things like virtual care in virtually every global health system. The value of standards in terms of reducing variation, improving confidence in our systems cannot be understated. Protecting the workforce and ensuring they trust and have confidence in their work environments will go a long way to a sustainable health workforce. new models of care that are meaningfully connected to patients and driving outcomes patients want to achieve. Preparedness, resilience, absolutely critical in terms of supply chain capacity, and emerging and capturing the data on inequality. Who are we not achieving great outcomes for? Absolutely is a key outcome of a clinically integrated supply chain. So with that, I am so grateful for the chance to share this work with you and very, very happy to take questions.
Thank you so much, Dr. Snowden, and Christina and Matt as well for a really fantastic presentation. We're going to start today's Q&A session. So if you haven't already, please submit any questions you have for our presenters by typing them into the Q&A chat box on your webinar console. So we've already had a ton of great engagement, and let's get started with the first question here. I think Dr. Snowden be best suited to answer this one. An audience member is wondering what resources are needed to achieve the nirvana that you just described.
Thank you, Bill. I like the word nirvana. The resources are first and foremost, based on the systems I've been working with, that the health system realizes the absolute value of moving from our supply chain of today to this much more proactive, predictive, digitally enabled system of tomorrow. So much of the resources start with the leadership vision and what's achievable, and having a clear line of sight in terms of what's achievable. In terms of resources, it really tough question because I don't know in any particular organization where you're starting from. So starting from your positions of strength and advancing along those 4 dimensions that we've talked about are really where much of the time and resources need to be focused. And I would say the clinician leadership cannot be understated. It was remarkable how quickly a single surgeon and it was a surgeon in NHS, it was a cardiologist in the US, the example I used, literally went from battling it out in our usual supply chain, can we buy all the various things out in that market, to let's just buy what works best for the patients we're looking after. So that would be a response, my best answer to that question. So hopefully I got close.
Absolutely. Excellent question. And really thank you for that breakdown there, Dr. Snowden. This next question would probably be best suited for Christina. Someone is wondering, how did they capture usage of things like Band-Aids in the technology that you're talking about, at the procedure level in an economic manner?
Sure. Yeah. Thank you guys for the question. So I will speak to specifically how WaveMark operates, so it won't be applicable to every solution that may be an option. But in the WaveMark system, what we do, and we spoke a little bit about it at a high level, is system integrations and interfaces. And so our solution is highly integrated in the clinical systems within the hospital. So what we typically do is we actually receive preference card information as cases are being scheduled and are being completed, and it's an exception-based documentation for the clinician. So the low dollar items within a preference card would be documented of plus or minus based on the preference card or what quantities were there. And then the high dollar items, as we talked about, what's really super important is that registration portion, and they are actually documented during the case so that we can get the exact lot, serial, and expiration that's being used for those items, the ones that really need to have tracking on them. So I hope that helps answer. It's a lot of preference card and integration and interfaces that allow us to be able to streamline the documentation of both high and low dollar inventory.
Yeah, absolutely. Thank you for those details. They're really, really good for understanding, and I think hit on that question very well. I also think this next question would be great for you, Christina. An audience member says the solutions seem to require changes for how my clinicians operate, which quite frankly they hate. So how does this reduce their burden, and how do we convince them about the value of the solution?
Yep, thank you. And I'll just kind of keep tagging on to what I just said. So one of the things, as I mentioned, is when products are registered as they come into the facility, we have in our system the tracking of all of those details that are associated with an item within the product. And so one of the ways that we can help streamline workflows for clinicians that really is a pain for them is the fact that they don't have to worry about doing any kind of manual entry when it comes to lot serial expiration. All of those attributes flow over into the clinical system as the product is waived using RFID technology during usage. So that's just one example of how we can improve some clinical workflows and gain some buy-in from our clinicians about making a change, because I know change, don't get me wrong, is always hard, especially in your space that's critical as a procedure area.
Excellent. Thank you for that great question and answer as well. If you haven't already, we do have plenty of time. Please keep submitting your questions. We've had a really great conversation so far and want to keep that going. And Christina, I think this next one is sort of a follow-up to the conversation we were just having, but someone's wondering what kind of effect does this data have on acquisition of new and emerging technology?
Yeah, that's a great question, and I guess I would ask just to maybe clarifying, because I don't want to answer inappropriately or incorrectly. When we say new and emerging technology, would that mean new and emerging technology in terms of medical devices and things that are going on with the advancement of medicine, or new and emerging technology in terms of how we actually, the systems that we use within the hospital ecosystem?
Great question. I would say the latter is probably safe to assume.
Sure. So I think, as Dr. Snowden mentioned, as we become more mature and data and analytics and automation become more critical to being efficient and effective and really making sure that we're operating with the patient care at the top of our priority, I think there is a need to continue to advance our technology and become more innovative than we've ever been about how we track items, understand usage patterns, understand outcomes. And so I think that the acquisition of new and emerging technology will always right now be on the forefront of what we need to do as a general health industry. For us at WaveMark, we are a SaaS-based platform, and we are in a continuous evolution of improving our current state. So that is very much part of what is embedded within our DNA of how we want to stay relevant and effective and appropriate for what's going on with both the clinical workflows and supply chain management.
Excellent. And just to be safe, was there anything you would add on the medical device part of that question?
Sure. So I think it goes back to, like Dr. Snowden was saying, with being able to associate outcomes with product selection. And so I think as new things come into play, new therapies, new devices, and medical instruments, if you're not looking at how effective they are in the outcomes of your patient, then you're not really using the data the way that you need to analyze it and take advantage of those insights. So lots of stuff comes out in the market. You can have competitors who release 3 things that are all competing in the same space. How do you know which one is the best? And so I think that's really becomes important, that you have those tools in place, that you have automation and data and analytics and insights in place, so that you don't get bogged down in what's new and what's flashy and what sounds great. You really base a lot of your decisions back to the data and the analytics and the outcomes, putting patients first.
Great observation. Thank you so much, Christina, for answering those questions. Going to switch gears a little bit, go back to Dr. Snowden. We have a question about how do you integrate lean methodologies such as Six Sigma into this process?
Yeah, that's a great question. There's been so much important work done on lean. Really, the maturity tool strategy essentially should align very nicely with Lean Six Sigma, although I haven't actually done that study specifically. But let me give you an example. When I was interviewing nurses in perioperative settings using or working within a highly clinically integrated supply chain. I had a nurse say, look, it's gotten to the point where I will never, ever work in a hospital that doesn't have this level of automation and integration of data in the workflow. She worked in an orthopedic surgical setting. She said it used to take her 4 hours to document the use of bone graft materials and all of the various places she had to document using human tissue. She said it now takes her less than 5 seconds because, of course, it's a simple barcode scan. So even that level of automation absolutely leans out, if you will, or automates that work environment. So it should work very hand in glove, but I have not done the specific studies with an organization to say, yes, here's what it does and how it does it. I'm just using qualitative responses when I was pilot testing this particular maturity tool some years ago. So hopefully that's helpful.
That's a really invaluable insight. So thank you so much for weighing in there. And kind of a question that, I think would be good for you as well, Dr. Snowden, would be someone's wondering, how would you recommend accelerating global standards adoption? Their experience is that the industry in general is very slow to adopt for manufacturer to use great data. So, what observations can you provide there?
Yeah, it's a good one. A few years ago, I guess it would have been 2018 when I was testing this and doing these case studies. Based on the 3-country case studies, they were reporting to me about 60% of manufacturers had adopted global standards. It was the other 40% they were having to work with. And remarkably, these health systems would actually work side by side with manufacturers to help them get their products adopting global standards. They did that initially, but they have now, to my knowledge, have set a policy framework that says, look, if you can't identify your products using global standards, we can't procure them from you, because it is that important for them, particularly now in this pandemic, to be able to absolutely be confident in the product attributes and that data is readily accessible when and where needed. So I haven't done a check back across manufacturers. Of course, there are many and different types of manufacturers, but at last look, there was at least 70% closing in on 80, 85, and that was 3 years ago. I suspect those adoption has continued to improve. It's the chicken and egg when it's required of them, or they cannot win a contract in procurement processes. It's amazing how quickly those global standards get adopted. My understanding is the large global national manufacturers have adopted it for sure as of around 2018, 2019, I would say.
Got it. Thank you so much. Great question, too. Just thanks for the audience for this really great engagement. We do have time for a final question today, and I want to get Matt involved as well. We got a great question that's come in about Cardinal specifically. So, an audience member is wondering, as a distributor, how is Cardinal providing more visibility around, what we've been talking about today?
Sure. Yeah, I think I mentioned a handful of capabilities we developed earlier during my talk, but maybe one to call out. Just a couple of months ago, we announced that we formed a partnership with a firm called FourKites to establish some really neat real-time transit tracking capabilities. It's been a technology we've been looking at before the pandemic, but as with everything, the last year's really accelerated development on that front. So what started out as a capability to track certain high value and temperature sensitive products in pharmaceuticals has now grown into a capability that we support across all of our pharma and med distribution businesses. So a really neat capability, and one that, as I mentioned, I think you'll start to see a lot more industry adoption of.
Excellent. Thank you so much, Matt. And final thank you to Christina and Dr. Snowden as well for just a really great, engaging presentation today. And thank you, Cardinal Health, as well, for sponsoring today's webinar. If you want to learn more about the content that you heard about today, please check out the resources section on your webinar console, and do, if you get a moment, fill out the webinar survey. Thank you again for joining us, and we really hope you have a wonderful afternoon.